Welcome to another episode of the Federal Newswire's Business of America podcast with your host, Jerry Rogers.
The business of America. These conversations are critical. Small business, innovation, the economy. And we need solutions. We have to find a place where we can have a conversation and come together and find answers. It is flu season. It is COVID season. My parents, as I'm sitting here today, I got word a couple of days ago that my mom and dad, who are both in their, mom, I won't give your age, but they're in their 70s. My dad's a little older than that, have COVID. And so respiratory illness, this is all top of mind. So we are very fortunate to have with us today, who I just had a chance to meet really this week, Phyllis Arthur from Bio. And again, we've had some conversations, but let me ask you, if you don't mind, to give a little witness to yourself, what your background is, what you do at Bio, and then I'm hoping we can talk about vaccines, talk about respiratory illness, talk about science, innovation, and I think maybe most importantly, but you can correct me, how do we get ready for the next pandemic? But
wonderful. Jerry, it's such a pleasure to be here. And I'm really looking forward to our conversation today. So I'm Phyllis Arthur. Thanks for inviting me. I'm the Senior Vice President of Infectious Diseases and Emerging Science Policy at Bio. Long title.
it is.
Bio is the Biotechnology Innovation Organization. We're a trade association based here in DC, and we represent the innovator companies working on products for health, also agriculture and climate change. So literally that umbrella of companies leveraging biotechnology. So exactly.
Wow.
Those companies leveraging biotechnology to literally bring us to a better place.
This is fantastic.
And so I work in the vaccines arena. I work with companies working on vaccines, new antibiotics, as well as pandemic preparedness products. And I've been at Bio almost 15 years, a little over 14 years. Before that, for about almost 17 years, I was at Merck and Company in vaccines.
Yes.
I did sales, I did marketing, I did international, I did US. So had a really great broad career in vaccines there. And before that, I went to business school at University of Pennsylvania. And before that, as we discussed, UPenn,
so you're smart too. As my mother would say, you have a head for knowing things.
Or I can fake it really well, one of the two. And then before that, I worked at the Brookings Institution here in DC.
Very good.
So love the policy space. It's been my life for a long time. And I'm originally from this area. I'm from Annapolis, Maryland.
I was going to ask you where you were from. I couldn't get your. I'm from New York originally.
It doesn't totally show.
Are you joking with me?
Poking a little.
It's funny. My sisters tell me that I've been here for 20 years. So we've been down here, my family in the Maryland, DC, the DMV, for 20 years, and they listen to me on a podcast or a radio show, and they're like, Jerry, you begin to sound like a Marylander. But I love Maryland.
And we have it's funny because my European friends pointed out my accent, because as a Marylander, you really think you don't have an accent. But of course you do. Of course you do. So I'm a native Marylander.
Well, I'm excited about this because, and I think I said this to you when we chatted off camera yesterday, and that is, we always are talking about the health crisis in front of us, or what's the health crisis behind us.
Yeah.
And, in science, in innovation, it really is, what is the health threat, the pandemic, the disease we don't know yet, that we have to be talking about new cures, new therapies, new vaccines, new interventions. And again, healthcare, and I love healthcare. My background is in healthcare policy. And it just, for 20 years now, it seems we, not you, not Bio, but many in this space are always talking. They're progressively advancing backwards in the conversation.
Relitigating whatever just happened.
And so I want to ask you, and we can riff off this, what is Bio? What is the public health community, the innovative companies and others doing to get ready for two things? Flu season, COVID season, respiratory illness. This is all happening. My parents have COVID right now. What are we doing to get ready for that? But then even maybe more importantly, what are we doing to get ready for the next pandemic that we don't know, hasn't presented itself yet.
Yeah, and actually these two things, I'm glad you laid them out that way, Jerry, because these two things are inextricably linked, right? The more success we have in helping everybody understand their individual risk and the power of the new innovations that are coming or have come to bear for the respiratory season, and the more people get comfortable with that, the more we lay a great foundation for being ready for the next pandemic.
Yes.
Because highly likely the next pandemic is either a respiratory thing or a bacterial thing. Right? So knowing that we've got kind of the viruses that are constantly sneaking up on us and getting more and more frequent every day, and we've got the bacterial issues that are poking through because of antimicrobial resistance, we kind of have several different potential waves coming at us that could cause a lot of unnecessary disease and economic problems if we don't solve them. So I think of these two things as being really connected. So we have in this respiratory illness season,
Right.
COVID updated vaccines coming in the next couple of days. We have new respiratory syncytial virus vaccines that have been introduced, RSV,
Yes.
the other respiratory illness that was causing so much problems for parents over this last year, as well as putting seniors in the hospital. So we've got vaccines for elderly, we've got a monoclonal antibody for babies, we've got a vaccine with an indication for pregnant women that protects babies. So we've got some new innovations for RSV. We've got the new updated vaccines coming for COVID that I understand are going to be very efficacious and really work against the variants that we're seeing right now. And then we've got, of course, the importance of continuing to keep high levels for flu vaccine, because you're not sure which of these respiratory illnesses you're going to get. And many of us have underlying conditions that make any one of these or two of these worse for us. So how do we get people to understand that they can get any one of these three and every one of these three in a staggered way over the next couple months? They could get their RSV vaccine right now. They're in pharmacies, their doctors are ordering them. They can get the COVID vaccines when they come out. They can get the flu shot in late September or early October to make sure it lasts through the season. They should be talking to their pharmacist, their nurse practitioner, their doctor right now to say, I want to stack these vaccines on top of each other so I'm protected. That's part one.
Okay.
I think the second part that is the innovations represented in those vaccines actually are the base for our pandemic preparedness.
Okay.
So the work done on mRNA for COVID is now going to be applied.
You know what's funny about this?
Yeah.
You're throwing out terms.
Oh, yes.
Yeah, that I think 3 years ago, we'd be like, what? But because of COVID and because of the intense coverage and also the controversies around it, these terms are now familiar. Mm-hmm. And I think that's a good thing.
Yeah, I agree. Yeah. I think the whole country and the whole world took a crash course in vaccines in the last 3 years.
Yes, we did.
And so I think that the COVID vaccines and the processes used to make them actually, along with other new vaccines, actually give us an opportunity to build a foundation for pivoting to both viruses we know have pandemic potential, as well as the unknown virus that could come at us tomorrow.
Yeah, right? That's what scares me.
That's what scares me too. And remember that these vaccines, like the mRNA vaccines, for example, they're not brand new, right? They actually were being researched for SARS, if we remember that.
Right, yes.
And MERS, if we remember that.
I'm old enough to remember these things.
I'm old enough to remember these things, right? So these vaccines had 10, 12, 15 years of research and development on them before they actually hit, as it were, with COVID.
That is such a... May I stop? Let me stop you there, because that's such an important point.
It really is.
Because, again, with the controversies around the vaccines, this isn't like all of a sudden, here's the vaccine. Right. This is decades of science and research and innovation and public-private partnerships. And this is personal to me because I understand how important this space is. And I've worked in public policy on health issues for 20 years now. And the public health community is so critical to our national health. Let me tell you,
and our national security.
Yes. Let me tell you a quick story, and for my conservative friends who are watching. And that is, years ago, I was invited. I was at Pharma, the trade association for the innovative drug companies. So I'll just say that. This is who I am. And I was invited to go and meet with the Heritage Foundation. And Heritage, of course, is a conservative think tank. And they were against the Medicare Modernization Act. Remember MMA back?
Absolutely.
Right. So that's, again, I'm dating myself.
Yeah. You and me both.
And they were dead set against it. And I couldn't understand it. I'm a right of center guy, and I didn't understand it. And I sat with them trying to go through this public-private partnership, how we have competition, how this is really the model for healthcare moving forward. I mean, yes, there were lots of problems with, I get it, but there was enough there that it deserved bipartisan support. And also, how do you have a Medicare program? How do you have this health insurance program for the elderly and not have prescription drug coverage? It was just insane to me, right? And I remember saying this, and I'll throw it back to you, and that is, I remember saying to the policy team there, George Washington, conservatives love George Washington. I bet you we can find a statue or a bust of him here somewhere in the office. They love him. Do you know that George Washington, as the first president of the United States, posted public health officers at all the points of entry, the docks, when ships came in? You know why? Because health is a public good. And if George Washington understood that, my goodness, Heritage should understand that. And you know what? Some folks in that room were like, yeah, it's a public good.
It is.
And so when we're talking about vaccines and science and COVID, my friends on the right need to understand that this is a public issue, a public good, and the government, as well as the private sector and the innovative companies, have an important role to play here. So I'm sorry.
Absolutely. No, that's pivotal. I think that the public health sector wants to make sure people have access, that they have the information they need to make the right decision for their family and themselves, right? That's really what we're all trying to do, is make sure that people have good, clear information.
Yes.
That they're talking to the trusted medical person they know well.
I'm going to wait till you say something that people should disagree with. So far, we need good information. We need to be talking to trusted advisors and family members. And again, let me just throw in there, because I'm an adult child of two people with COVID right now. Adult children need to talk to their parents.
Absolutely.
About what's happening.
Family goes up and down. Right?
And you know, my mom and dad raised me, and they are still in good shape, thank God. But it is our responsibility now as adult children to say, hey, Ma, when you go to the doctor, why don't you ask about
these things?
Yes.
Engage that, and engage within that office, right? Talk to the nurse practitioner and the nurse and the doctor. Like they all have slightly
I'm partial
different.
to the nurse practitioners because
I love nurse
because they
practitioners.
spend time with my children went yesterday.
Or the PA.
They went to they got their health checkup yesterday.
Okay.
And both my little ones, one is 9. My youngest, I have 5. My 2 youngest, 9 and 13, came back, and they were like, woohoo! I'm 4'10", 86 pounds. And they actually liked the doctor's office. So I said to my wife, I said, "What happened over there? When I was a kid, I hated the doctor."
Yeah,
and it was the nurses and nurse practitioners.
Yeah.
Anyway, I'm sorry.
They really know how to engage, and they know how to talk to mom, parent to parent. And so I think it's really important for people to take the time to think about their risk. Literally, underlying conditions, the fact that we're all trying to live our best lives, right? We don't want to go back to masks or closing anything. That's not what anyone's talking about.
Me, I gained a lot of weight.
Me too. We really want to make sure that the freshman 50, the COVID 15, right? The COVID 15.
Well, for me, it was COVID 50.
So we really want to make sure that people are having and engaging in these really important conversations for themselves, husband, wife, up, down, kids, grandparents, etc., because it's really not a time to get sick. It really impacts let's think about it from the productivity standpoint, right? So, you don't want to be sick because you don't want to be sick. You don't want to go to the hospital because you don't want to go. That's
moms and dads have they have mom and dad things to do, and they have work to do.
Exactly. And hospitals are the worst place to get well. I think we can all agree on that, right? Yes. So literally, you want to stay out of the hospital. You want to stay well. You want to recover as fast as possible. To talk about treatments, because inevitably, unfortunately, you might get COVID. Yes. But if you're vaccinated, right, for COVID, or you're vaccinated for RSV, you're vaccinated for flu, if perchance you, what we call breakthrough, you get an infection that causes disease, you are going to be way less
And I want to ask you about this because, and again, I don't understand how some in our public discourse have these conversations. is it all just to own the other person in terms of like own the conservative, own the liberal? Because here's the thing, nothing is foolproof.
Oh, no.
And I don't understand why the expectation was that everything had to be foolproof. It had to be some kind of like Superman shield of protection. The bottom line is that it is a layer of protection. And no science is perfect. Nothing is perfect. And so therefore, and you said this already, and I think it's very, very important for our listeners and our viewers, it's not risk-benefit. It's risk-risk. The risk of going through these protocols and having these medicines and these therapies versus the risk of not doing it. And that's the conversation you need to have. It's not risk-benefit, it's risk-risk.
Yeah.
Everything's a risk. And it's layers.
I think of it as risk management.
Yes.
Literally, people need to understand that the risk of an actual full-on case of COVID or RSV or flu, what that means, what kind of consequences can come from that, hospitalization, respiratory illness, complications from diseases you already have. A lot of people jokingly say, but not really, a patient with an underlying condition, a diabetic, go in the hospital with one thing and go out in the hospital walking and come out on a walker, right?
Yeah. You
don't want these consequences of these infectious diseases across the board. It's surprising to me. There are actually there are over 700 hospitalizations for children under 12 right now with COVID. This is a surprise. I think we all think that no one's having consequences.
Right.
And a lot of Americans are having consequences.
Sure.
And so thinking of that risk management is I think one of the things to discuss with a healthcare professional, because you want to manage your risk of getting sick, being out of work, not being able to manage the parents, having the parents be in the hospital. All those downsides really can be mitigated in part with vaccination and then other good sense policies.
And the good news here too is that you hear some on the right. I'm picking on my friends on the right today, and I'll pick on my friends on the left in a second. But a lot of criticism on in some communities, both right and left, I'll say that, is they don't want the government interfering. But everything you're talking about here is doctor, patient,
voluntary,
is husband and wives and children, moms and dads, grandparents, pastors and congregations. The little, I say this all the time in all my shows. I might as well say it again. It's the little platoon. Evan Burke called these voluntary associations, these community organizations, the little platoons. What you're talking about is activating the little platoons to go out there and make sure the community is safe.
Absolutely.
No one's talking about government coming in and doing this or doing that.
Absolutely not.
But unfortunately, this conversation gets overlaid with that. And I think, look, there's a lot of politics in healthcare. I get it. I'm not naive. But at the end of the day, when we're talking about health care, not health care, the systems, but health care for you, for me, for my kids, we want risk or risk management. We want information. We want access to our doctors. We want access to medicine. Let me ask you that for a second, because I'm always concerned because of finances. I have a big family, and thank God we have health insurance. But I know that when the recommendations come out for the COVID vaccines, there's different ways this might happen, and this is important because of how the vaccines, the insurance companies or payers will reimburse or pay.
Cover.
Can you talk a little bit about that?
Yeah. So one of the things that I think is great about the last couple of years is more and more all the different insurance programs, private and public, so Medicare, Medicaid, private insurance, all now should offer all vaccines recommended by the CDC at no out-of-pocket costs for the patient.
Okay.
This is our goal, right? Part D in Medicare, if you go in the pharmacy and get it, your private insurance, et cetera. There's a little bit of complexity because the cleanest way to have all the insurers quickly cover the COVID vaccines is to have them have a routine recommendation. And it's important to note, Jerry, a routine recommendation does not, ! Equal a mandate.
Yes.
Not
all
at
right.
all.
Let's circle that.
Yeah, let's
and
circle
underline
that.
it and say
if
the CDC makes a straightforward routine recommendation, it has nothing, zero, nada to do with mandates.
That's correct.
Amen.
Mandates are something decided at the state level Federal government doesn't. I
or
mean,
corporations or whatever.
right, companies, whatever.
But the CDC is not going to make a recommendation that everyone must.
Correct.
Right.
Their recommendation is such that clinicians can have a clear conversations with people.
Right.
That's it. Right. So the cleanest, quickest way to that broad insurance coverage with no out of pocket is a routine recommendation for all populations for which the vaccine is indicated by the FDA.
Yes.
That's the cleanest.
And that, again, I know that might sound like very simple to you or even to me, but to our viewers who are worried about, look, my kids went to the doctor yesterday, and I still get a little nervous about insurance coverage. Now this was their checkup, so there was no, but regardless, I'm always, are we up to date? Or, I mean, I can't help but panic a little bit. I shouldn't, but I do.
Have a little anxiety.
I do. And again, people have anxiety about healthcare. And so that's why I am, and I'm looking forward to this conversation, because we could get rid of the boogeyman arguments. All right? The CDC comes out with a straight recommendation, has nothing to do with mandates. That is a simple truth that everyone needs to understand.
Absolutely. It's pivotal because, again, this is about, like we've been talking about the whole time, the patient or parent interaction with the healthcare professional, wherever that is.
Sure.
And yes, it's right for me. That's what I want to do.
Yeah.
And taking away those financial barriers is one of the cornerstones. Yeah. We don't want people to have any access issues. We want you to be able to walk into a pharmacy, know that your insurance, if let's say your insurance says, okay, your immunizer that is covered is CVS. Walk into that pharmacy, get whatever vaccine you were going to get there, have that conversation, walk out. Yeah. Right. This is what we're shooting for. That's what this should be.
And we don't want people. I say we. I'm going to put myself in.
You and I are driving this whole thing. That's right.
we don't want people not to get the vaccine or any intervention because they're afraid to pay.
Yes, that is actually right.
We're afraid about the payment.
And we want people to understand that if you have Medicaid, Medicare, A, B, or C, or D, and private insurance, you should not face this issue, right?
Sure.
The stronger that recommendation that comes from the CDC, the faster the insurers of all types will make that available with that zero out-of-pocket cost.
You know, it's interesting because I'm sitting here and, you know, I do a lot of healthcare policy and the politics around it. We need to have more conversations about the science, about the innovation, about what the pharmaceutical companies, we used to joke at pharma that pharma was the bad guy and bio was the good guy.
We're the white hat.
Yes, right. And we were the villains and you were the heroes. But the innovative biopharma sector in America is a success story.
Absolutely.
And it is
a competitive advantage to the country.
And we should be, our politicians, well, corporations to be held accountable. Billy Tozen, who used to be a member of Congress, but also he was the CEO of pharma.
Absolutely.
He would always remind us, if you don't want to be accused of doing bad things, don't do bad things. So I get it that corporations need to be held accountable. I get it. And I think both the left and the right would agree with that. Mm-hmm. However, we have to stop beating up on this very, again, innovative, unique American. We're the leaders. America leads the world in science, innovation, and biopharma.
In biopharma and in biotech, absolutely.
And we should be, again, having conversations about health interventions, but also having conversations about not beating up on the, what's the cliche? The goose that lays the golden eggs. Let me just say a quick story, and I'll get your thoughts on it. So when I was younger, I was younger. Actually, it was a long time ago. I was at pharma. But I remember meeting some of the old timers there, folks who had been at pharma for a long time. And there's a guy. He was a really good guy, and he was not on the science side. He was on the communication side, and he was going through all these different issues. And he said, Jerry, he said, pharma years ago, most of the lobbying we did or the political interactions that we did was on cosmetics. And I said, what? He said, yeah. He said that it wasn't until after these breakthrough cures and breakthrough medicines that we really started to shift to the what we consider today as the pharma issues. And he said, we could go back to just being cosmetic companies. What he was saying to me was the regulatory environment, the political environment, the public discourse. You keep on beating up on something, eventually they might not be there anymore. And so, again, for our listeners, I think it's important, especially now, it's easy to beat up on the pharma industry or sector or bio sector because we're angry about something else. And we have to have straight conversations about this. I want to ask you this, though. Do you participate in education opportunities? I know you lobby and do that sort of thing, but how does bio take the message out?
Absolutely. So I think one of the things we've been doing literally the entire time of the COVID pandemic and now carrying into supporting those trusted organizations close to the community that are talking about routine immunization, that are getting people back on track for getting their kids up to date, getting their teenagers up to date, making sure that grandma and grandpa are up to date, that any patient with an underlying condition is up to date. We are focusing a lot on partnering with those organizations, be they church groups, people are doing things with barbershops and hairstylists, people are doing things with,
I heard that they're working with the Olympics and the Olympic boxing.
People are working with the Olympic committees, the various Olympic teams. People are working across multiple different, both people who can tell the story of why they got vaccinated and those who can, offer a convening spot that's a trusted place. So, Black Churches Initiative, Evangelical Churches Initiative, where literally a doctor might come from the community or they might have a health fair. People doing things at state fairs where they've got, doctors from the community offering vaccines at a location. These kinds of literally on the ground, very locally driven opportunities to engage with somebody are key.
And again, think
and
about
this. And supporting a lot.
But this is exactly too, I've done a couple of these shows and we've been focused on small businesses and how small business is the backbone often
the engine of the U.S. economy.
Of communities, that sort of thing. Right. And I'm thinking back too, when I played Little League, it was a small business that sponsored our team, right? And so the importance of small businesses, and this is really a not trickle down, it's trickle up. If that's a phrase, we'll coin that phrase here. Trickle up. But that's what you're talking about in terms of health.
I mean, think of it. Small businesses often, before, and hopefully we go back to this, right? They work with, say, Visiting Nurses Association or the CVS local to vaccinate their staff, for example. They offer flu vaccine, and they could do that with flu and COVID. Those folks on the ground, those pharmacists, those visiting nurses groups, the health departments are happy to actually come at the behest of somebody and vaccinate.
I'm going to tell you another quick story, and then we'll wrap it up.
Okay.
And I can talk to you forever, by the way.
Yeah, we always have a lot of fun.
But I coached football, varsity football, and I was the head coach, and we were the only high school in our county that did not shut down during COVID. But here's what we did right away. And it was the football coaches, and it was the school too. We had a team day where the entire team came in and we provided at the school vaccines.
And for school vaccination, again, always with the permission and consent of parents.
Oh, no, of course, yes. No.
But I'm
sorry, I didn't kidnap the kids.
Exactly.
All the parents, all that we had, of course, I mean, everything. Right. I'm sorry. Right. Thank you.
Literally, that has, again, we're going back
Coach Rogers has all the kids in the back. What's going on? No.
Kidnapped our children. Using those models that we used for flu before the pandemic, or some of them that we used during the pandemic to reach people, we got to go back to those. The mobile vans through the community.
But the thing is my point is that we had a football season.
Yeah.
Now, we had to play a lot of teams that were outside of our area, but because a lot of other schools weren't proactive. And again, back to your point, where productivity, where athletics,
education, maintaining education for the kids. I mean, we want to do these things. We don't want to slide backwards. We want kids to stay. We want people to stay where they are.
I did hear this about the Olympic boxing team is very engaged in the vaccines, flu and COVID and the respiratory illness, and I love it. My father was a prize fighter. He was Golden Gloves, and I like this approach. It's jab, 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 right cross.
Right.
And that's what we're talking about here. It's communication, it's information, it's science, it's
It's the right messenger talking
boom,
to you.
jab,
Yeah, absolutely.
And the right cross is you don't get sick maybe, or you get sick and it's not as complicated or puts you out.
And I think that as you're pointing out treatments, just to close us up, it's important to know if you get sick, either unfortunately you don't get vaccinated or you get vaccinated and somehow you have breakthrough, there are actually really good treatments that your doctor should talk to you about.
Those.
Right,
Oh,
and that's why I'm doing it.
I have to have you back.
That's right.
Come on,
Yeah,
give us a couple.
So you got Paxlovid, you got
Yes, thank
Paxlovid
you.
and
Oh, my
molnupiravir.
goodness.
You got 2 antivirals.
Yes.
Well researched. Your doctor can
More
help
innovation.
you. Your doctor can help you. And these were both really cool breakthroughs because before we really weren't sure how to approach antivirals for this particular virus, right? So these 2 products represent really good technology. They were well researched globally.
Yes.
And so it's really important for people to be able to get these quickly, take action quickly.
And you just saved the show because I had it. I have little notes over here off camera, and I was going to ask you about the treatments, and I didn't. But this is fantastic.
Yeah.
This is a great conversation. Thank you for joining us.
It's my pleasure, and we can talk more about pandemic preparedness later if you want.
Yes, we should.
There's some really cool things
and also
going on there.
other folks from Bio to come over and talk about some other issues.
Absolutely.
Again, the name of the podcast is Business of America. We're going to be talking about innovation, science, breakthroughs, and also solutions. And how do we talk to each other and with each other? It's all about solutions. So I'm glad that you came in today. Minding our business. You like that for a tagline?
I love it.
Minding our business.
It's a great conversation. Thanks so much, Jerry.
All right, thank you so much.
This has been the Federal Newswire's Business of America podcast, hosted by Jerry Rogers. Check out the Federal Newswire's family of websites, as well as their social media stream